Whereas when you come to us, we're going to give you an injectable.
Correct.
Unless you strongly prefer to not inject, which we will work with you for, of course, but we're going to highly recommend injectable. Yes. And there's a reason for that.
Yeah.
So what's that reason?
Yeah. So let's talk about that. The first main reason is bioavailability.
Which means?
That means if you inject something, you're getting basically 100% of it. You know what I mean?
Your body knows how to use that.
Yes.
Your biology knows how identifies with that thing.
That, and you're just getting the bulk of the ingredient because it's being injected. When you use a patch, you are relying on technology to try to get it through the skin, and some people's skin's thicker, some people's skin doesn't take it as well. I've literally seen, let's take, for instance, we've had a couple male patients come to us who are on patches. And they're like, I'm just not feeling that great. And when we looked at their old lab before they started the patch, their testosterone was now lower.
After the patch.
Yeah. Now, here's what's happening. They weren't absorbing the full dose. So what happens is, we've talked about negative feedback loops before. When your body senses hormone, it shuts down your natural
production.
So let's say you were at 200, or well, you'd have to, for a doctor to do it, you'd have to be under 200. So let's say you were 195. Starts the patch, 8 weeks, comes back, and this guy was in the 150s. Feels terrible. Why? He wasn't absorbing the full medicine on the patch. He was getting a small amount. So what that was doing was hitting the body, saying, oh, well, I'm getting some exogenous testosterone, and it lowered his output.
So it was giving it just enough
to slow it down, to shut it down. Correct.
But not enough
to get a supervisor to get a boost. So absorption is going to matter different from different people. There's going to be people who are going to absorb it great, and they're going to do well. And there's probably someone going to watch and say, well, I'm on the patch, and I did this, and I did great. But there's enough people that don't absorb it well, that have these problems, and they don't feel any better. We want to make sure that we're nailing it as much as possible, right? We don't want to have those situations where people come back and go, oh man, I'm just not really feeling this. You know what I mean? So absorption's a big one with that. I don't know that it's really that inconvenient to have a patch on, but you still have to wear a patch. So there is some inconvenience there. Also, just in terms of, we like injectable because we can make the dosing very steady. Okay, so when you put the patch on, you're still going to get a bigger bolus dose right then and there, and then until you put another one on. So you're going to yo-yo up a little bit more. Whereas we can spread the injectables out and keep your levels more level.
Steady.
Yeah, steady. And you don't want hormones yo-yoing. When it comes to pellets, I've seen a lot of bad blood work. I've seen women who come to me for the first 2 weeks, they're at 800 on their testosterone total. And a woman should be around 60 at the top.
Yeah.
And their freeze quadruple, and that's where you're going to get side effects. Women are going to get hair thinning there. Women are going to get facial hair there. They're going to get, and the problem is women who aren't very lean. So let's say you're a menopausal woman, you had a family, you devoted yourself to that. You weren't really in the gym. You weren't really worrying about body fat. And now, you want to do something for yourself, and you're trying to get in shape and you're trying to lose weight.